Have you ever wondered how HIV/AIDS impacts our communities on a daily basis? It's a question that's not asked nearly enough, and yet the answer to it is crucial for us all. Every corner of the globe is touched by HIV/AIDS. It's not just a health issue, but a social one, affecting relationships, families, and communities. It's an issue that doesn't discriminate, reaching into cities, towns, and villages, affecting people of all ages, all genders, all walks of life. Understanding HIV/AIDS, its transmission and prevention is crucial. But more than that, understanding the lives of those living with the disease, their struggles and triumphs, is key to changing perceptions and eliminating stigma. Because awareness isn't just about knowledge, it's about empathy, it's about empowerment, it's about making a difference in the lives of others and in our own lives too. So let's dive deeper into this issue and uncover the truth about HIV/AIDS. First thing first, what exactly is HIV/AIDS? Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system, specifically the CD4 cells, often referred to as T cells. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease. When this happens, HIV infection leads to acquired immunodeficiency syndrome, or AIDS, the final stage of HIV infection. However, not everyone with HIV progresses to AIDS. With proper treatment called antiretroviral therapy, or ART, HIV can be controlled. People with HIV who take ART as prescribed and get and keep an undetectable viral load can stay healthy for many years, and they have effectively no risk of transmitting HIV to an HIV-negative partner through sex. Now let's clear up some common misconceptions. HIV is not a death sentence. In fact, many people with HIV live long, healthy lives thanks to advancements in medical treatments. And no, HIV cannot be spread through casual contact like hugging, kissing, or sharing utensils. It's primarily spread through sexual contact, sharing needles, or from mother to child during birth or breastfeeding. It's also important to note the difference between HIV and AIDS. HIV is the virus that causes the disease. AIDS, on the other hand, is the final stage of the HIV infection. Not everyone who has HIV will develop AIDS. HIV becomes AIDS when your immune system is so severely damaged it can no longer fight off opportunistic infections and diseases. So, to sum up, HIV is a virus that attacks the immune system. If left untreated, it can lead to AIDS. But with proper medical treatment, people with HIV can live healthy, normal lives. And remember, HIV is not spread through casual contact. It requires specific modes of transmission. Now that we know what HIV/AIDS is, you might be wondering, how does it spread? How does HIV/AIDS spread from person to person? It's a question many of us have, and today, we're going to answer it. HIV, short for human immunodeficiency virus, is a virus that attacks cells in the immune system. If left untreated, it can lead to AIDS, or acquired immune deficiency syndrome, a stage of HIV infection where the immune system is severely damaged. HIV is transmitted through certain body fluids that attack the immune system. These fluids include blood, semen, vaginal and rectal fluids, and breast milk. Now let's make this clear. HIV isn't transmitted through casual contact. Shaking hands, hugging, or even sharing the same space with someone who has HIV won't put you at risk. It's not spread through the air, water, or insect bites either. These are common misconceptions that we need to debunk to understand the real risks and prevent the spread of this virus. The most common way HIV is transmitted is through sexual contact. Unprotected sex with someone who has HIV is a high-risk activity. This is because the virus can be present in sexual fluids and can pass from one person to another. Sharing needles, syringes, rinse water, or other equipment used to prepare drugs for injection also poses a high risk. Why? Because the equipment may have traces of HIV-infected blood. Mother-to-child transmission can occur during pregnancy, childbirth, or breastfeeding. However, with proper medical care and treatment, the risk of transmission can be significantly reduced. Lastly, receiving a transfusion of infected blood, blood products, or organ transplants can transmit HIV. However, in many countries, rigorous testing for HIV is mandatory, making this mode of transmission extremely rare. It's crucial to remember that not everyone living with HIV develops AIDS. With proper treatment, many people with HIV live long and healthy lives. Knowing how HIV/AIDS spread is crucial, but it's just as important to know how to prevent it. Let's dive deeper into that in our next segment. Preventing the spread of HIV/AIDS is key to protecting ourselves and our communities. But how can we do this effectively? When it comes to HIV/AIDS, prevention truly is the frontline defense. The first and most effective method of prevention is practicing safe sex. This includes using condoms and dental dams consistently and correctly. Also, it's important to get tested regularly and know your sexual partner's HIV status. Consider this: if you are sexually active, getting tested for HIV should be a part of your routine health checkups. HIV can take up to 3 months to show up on a test, so it's recommended to get tested at least once a year, or more frequently if you have multiple partners or engage in high-risk behaviors. Another important prevention strategy is the use of antiretroviral therapy or ART. For those who are HIV positive, taking antiretroviral drugs can suppress the virus to undetectable levels, drastically reducing the risk of transmitting the virus to others. This concept, known as U=U, or undetectable equals untransmittable, has revolutionized the fight against HIV/AIDS. For those who are at high risk of contracting HIV, there's a preventative measure called pre-exposure prophylaxis, or PrEP. When taken consistently, PrEP reduces the risk of getting HIV from sex by about 90%. But prevention doesn't just end with medical interventions. Education and awareness are crucial. By dispelling myths and misconceptions about HIV/AIDS, we can reduce stigma and create an environment where people feel safe to discuss their status, get tested, and seek treatment if necessary. Lastly, let's not forget about harm reduction strategies for those who inject drugs. This includes using new, sterile needles and syringes for each injection and never sharing injection equipment with others. Prevention is always better than cure, especially when it comes to HIV/AIDS. But what if someone is already infected? Living with HIV/AIDS is not the end. There are ways to manage the disease and lead a healthy life. Today, we have a range of treatment options available. Antiretroviral therapy, or ART, is the cornerstone of HIV management. It doesn't cure HIV, but it can control the virus and prevent its progression into AIDS. Early diagnosis is crucial. The sooner you know your status, the sooner you can start treatment, and the better your chances of leading a long, healthy life. Regular medical care is also essential. It enables your healthcare provider to monitor your health, adjust your treatment as necessary, and manage any side effects. Living with HIV/AIDS also means taking care of your mental health. Support groups, both online and offline, can provide a safe space to share experiences and gain strength. It also means fighting stigma and discrimination, because nobody should face this journey alone. Regardless of the challenges, it's important to remember that being HIV positive is not a death sentence. Empowering our communities begins with each one of us. It starts with understanding, empathy, and action. We've journeyed together through the key aspects of HIV/AIDS. We've shed light on its nature, how it spreads, how we can prevent it, and how life continues even after a diagnosis. It is our collective responsibility to carry this knowledge forward and use it as a tool for empowerment. Let's break the chains of stigma and fear. Let's replace them with understanding and compassion. Let's create a safe space for conversations about HIV/AIDS. Let's be the catalysts for change in our communities, spreading awareness, promoting prevention, offering support to those who live with HIV/AIDS. Our strength lies in our unity and our commitment to a healthier future. Together we can turn the tide against HIV/AIDS. Remember, knowledge is power. Let's use it to fight HIV/AIDS and create healthier, stronger communities.